Hello everyone, welcome back to our channel. We are looking on several factors in relationship building under the clinical communication criteria of the OET speaking test. So, the next factor is showing empathy. What do you mean by empathy? It's all about understanding and sharing the emotions of others, right? If you want to show empathy effectively in your speaking test, you need to focus on choosing words that reflect understanding, reassurance, and collaboration. Examples, you need to use phrases like, I understand how you feel, or I can see why this might be worrying for you in order to acknowledge the patient's emotions, offering reassurance with statements such as, let me assure you that we will work through this together. Or, this is a common concern and I'm here to help. So, all these statements will reassure the patients. Choosing inclusive language by using we instead of you or I, which creates a sense of teamwork and partnership. I'm going to show you some scenario where a general practitioner is speaking with a patient who has been experiencing persistent headaches and is worried it might be a symptom of a serious illness such as a brain tumor. So the patient is saying like this, Doctor, I have been having these headaches for weeks now, and I can't help but think it might be something really serious, like a tumor. It's been so hard to concentrate at work, and I feel scared all the time. And here's how the general practitioner should reply. I can see how these headaches are affecting both your peace of mind and daily life, and I completely understand why you're feeling scared. It's natural to worry when something like this is disrupting your routine, and I want to assure you that your concerns are valid. The good news is that most headaches, even persistent ones, are caused by issues that are not serious, such as attention or migraines, which we can manage effectively. That said, I want to make sure we investigate this thoroughly to rule out anything concerning. We'll work through this together step by step, starting with some tests to understand what's causing the pain. So, in this example of doctor response, here the doctor validates the patient's fears without dismissing them. Phrases like, I completely understand why you are feeling scared and your concerns are valid, create a safe space for the patient to express emotions. And the statements like, most headaches are caused by issues that are not serious. So it offers factual reassurance while avoiding false guarantees. And when it comes to we will work through this together. So, this means the doctor emphasizes a collaborative approach, ensuring the patient feels supported. And he's clearly outlining the plan for investigation. Example starting with some test. This means he is explaining how to plan for the future investigations to take up with some important tests that the patient might feel informed and reduces uncertainty. In OET speaking test, specifically when focusing on the criterion of understanding and incorporating the patient's perspective. This is the next criterion, which is very important to engage the patient or their relative actively in the conversation. This involves more than just giving information. It means carefully listening to what they think and feel about their situation, responding in a way that reflects their views. Here's how you can approach it. The first one is eliciting the patient's views. When you're interacting with the patient or their relative, it's very crucial to ask open ended questions that allow them to share their thoughts and feelings. This not only helps you understand their perspective, but also it will build a rapport. For example, you might ask questions like, how are you feeling about the treatment options we have discussed so far? What are your main concerns regarding this condition? What do you think would help you feel more comfortable with the next steps? So these type of questions open up the conversation and invite the patient to express themselves fully. When you ask about their concerns or what they think, you are directly engaging them in the process, which helps them feel more involved and valued in their care. And the second one is exploring the patient's views further. So once the patient has shared their initial thoughts, it's important to explore these views further. You can do this by asking follow up questions that dig deeper into their concerns or opinions. For example, you mentioned feeling unsure about the treatment options. Could you tell me more about what exactly worries you? So, this means you are exploring the patient's views further. I hear that you are open to different options, but are there any specific things you are hoping to avoid? You can also show that you understand their point of view by summarizing that what they have said and asking if you're on the right track. For instance, it sounds like you're feeling uncertain about the new treatment plan, but you're also open to exploring what might help. Is that correct? Here, you are summarizing their understanding and you're also making sure that you're going on the right track. The next one is about relating explanations to the patient's view after you have understood the patient's perspective. Now, the next thing is to incorporate this understanding into the explanations you give. When you explain something, make sure you relate it to the patient concerns or preferences. This demonstrates that you are tailoring your advice or suggestions to fit their specific needs. For example, on a speech therapy setting, you might say, I understand that you're unfamiliar with assistive technology and feel a bit overwhelmed by the newness of it all. Let's take it step by step. We can start with a full assessment of what your loved one needs and what their capabilities are, and then we'll work together to find the most suitable tools. We'll ensure that you both feel comfortable with the technology before moving forward. Here, you're acknowledging the patient's lack of familiarity and apprehension, and you're offering a clear and manageable plan that addresses their concerns. Here is an example context. I understand that this diagnosis is very overwhelming. What are your biggest concerns about the treatment plan we have discussed? And the family member would say, like, well, I'm not sure how much time we have left to try different treatments, and I'm worried about the side effects. Then you should say, like, it's completely normal to feel concerned about time and side effects. Let's focus on what we can do right now. We can explore treatments that have fewer side effects and also talk about palliative care options that focus on quality of life. Does that sound like a good approach to you? So, here you're asking open ended questions, exploring their concerns, and relating your explanations to their specific worries, and you demonstrate a patient centered approach here. This approach reassures the family member that their concerns are valid and their input is an essential part of the treatment planning process. In summary, eliciting and exploring the patient's views means asking questions to understand what they think and feel. Relating your explanation to their viewpoints shows that you have listened them carefully and that you respect their perspective too. So these steps helps to create a collaborative and compassionate dialogue ensuring that the patient's voice is heard in their care journey. Got it? That's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye for now.